there, I'm Shannon Piggott with Breed Specific Healthcare, and this edition of Ask the Expert, we have Dr. Nan Boss with Best Friends Veterinary Center here to answer some questions about how to implement breed-specific wellness in your hospital. So Dr. Boss, many folks want to know what are the hurdles for implementing breed-specific wellness?
I've hurdled them all, so I can tell you about that. I'm the advocate for the University of Wisconsin's Veterinary School. I work with the VBMA groups that are at all the veterinary schools and do their programming for their annual meeting. And so I know what the students are being exposed to. I think a great deal of the problem with wellness and prevention in general is that we get almost nothing on it while we're in school. So when we are in veterinary school, we are taught normals and then abnormals. We are not taught maintaining normal. We're taught by specialists, most of whom have never been in general practice and have not a whole lot of interest in wellness and prevention. And yet when we get out of school, 60% of what we do every day is wellness. It's the annual exams, the spaying and neutering, dental cleanings, heartworm tests, puppy and kitten visits, all of that stuff. We veterinarians generally are very good at learning auditorily sitting in a lecture because that's what we did all the way through 8 years of college. So a lot of our clients are not auditory learners and they don't want to listen to a lecture. So you have to have the written materials, you have to have the props and the pictures because people are going to remember a picture or a diagram much better than they're going to remember something I say verbally. So I have to be thinking of myself as an educator. I have to train my staff to do that. I have to have handouts for every disease. I talked earlier about consistency of care. So that means for every disease I diagnose, every treatment plan I come up with, every medication that goes home with the client, I need written materials because the client's not necessarily going to remember what I tell them. So for me, being a good veterinarian has to do with organizing my practice and getting that structure in place so that it's automatic and it happens every single time. Every client gets that handout that explains the drug side effects. Every single client gets their diagnosis in writing. Here's what we think is wrong with your dog. But when you start doing client education, you will be amazed at how many diseases you will find that you didn't know were there, how many rechecks you're going to have to do to recheck those diseases. You are going to make way more money doing this than you would spend on your consultant. It is worth that extra 10 minutes of time with every appointment to talk to clients about this stuff. It's worth the time it takes you to train your team because the medicine's going to be better and financially it's going to be way better.
Dr. Boss has just spent quite a few minutes here with some fascinating and fantastic insights on how to make your practice better. Having 7.1 visits per year per pet in her practice, those numbers speak volumes. And so thank you for dialing in to ask this expert. Dr. Boss, thank you for your time and for your insights.